So today we're going to be talking about Obamacare. I just want you guys to know that I'm from a neutral view. It's all factual, it's not opinion, so just keep that in mind as I'm presenting this speech. In 2008, there was an election between Barack Obama and John McCain that resulted in Obama becoming our 44th president. A main focus of his campaign was healthcare reform, making sure everyone got an equal opportunity to have healthcare. What he put in motion was the Affordable Care Act, also commonly known as Obamacare. When he signed this act on March 23, 2010, it made it mandatory for everyone to have health care by January 1st of 2014. The main goal of the ACA is increasing the affordability and the rate of insurance coverage and reducing the overall costs of health care. There is a grandfather clause, though, stating that any policies put in action before the signing of the ACA will be exempt from some of these new provisions, but others can be affected. I don't want to go into detail about this act because there's many bunny trails to go off on. There's a lot of information, but I want to focus on the consumer and how it's going to affect us. I'm only going to focus on some of the future provisions and what's next. Starting in October of 2013, those that are looking to buy individual health insurance can enroll in subsidized plans offered through state-based exchanges, which the coverage will begin January 1st of 2014. State-based exchanges is where states can open a marketplace where people can submit applications to get health care. Several states have applied to run a statewide marketplace. If they haven't applied already, the date has passed to get a statewide health care marketplace, and if they haven't already, the federal government is going to take over and run the marketplace for them. Oklahoma did not decide to go with a state-based market, so that the federal government is going to take over and run our marketplace exchange. These exchanges are for individuals only. Companies will decide if they want to keep the health care or get rid of it. If they decide to keep it, then the people that work for the company are all good. If they get to get rid of it, they will pay the annual penalty, and the individuals of that company will be responsible to get their own health care that they need to enroll by October 2013, where the health care will take over January 1st of 2014. To get accepted in these exchanges for healthcare, you cannot be eligible for any other coverage, being Medicare or Medicaid or any other coverage. The healthcares cannot reject people from these marketplaces based on age, gender, the demographics, where you live, who you are, or pre-existing conditions. This does exclude tobacco use. If you list on your application that you have cancer due to a tobacco use, they can reject you. If you enroll without telling them that you have a tobacco use pre-existing condition, they accept you, they cannot get rid of you. The penalties to this is a $2,000 per employee penalty will be imposed on employers more than 50 employees who do not offer health care insurance to their full-time workers. Individuals who are not covered by insurance policies are going to be charged an annual penalty of $95 or up to 1% of their income, whichever is greater. This will also rise in 2016 to a minimum of $695 or 2.5% of your income. Families will be charged $2,085 or 2.5% of their income, whichever is greater. But they cannot expect you to pay more than 8% of your income as long as the 8% of your income costs more than the basic health care plan. So saying that if you are going to end up paying more than the basic health care plan, it's cheaper for you just to go ahead and get the health care plan than to pay the penalty. Starting effective January 1st of 2014, these are some of the provisions that come with that. Currently, the insurance that we've got in 2013 is not income-based. Currently, a person can choose what plan is best for them or their family, what they can afford. And the biggest change with this is now your premiums are based on income. As an example, I live in Owasso, so the average family in Owasso makes roughly $62,000 a year, which is, when calculated, 300% above the national poverty level. There is a chart online that talks about the different percentage of poverty levels and the different income rates, and I won't get into that, but it's saying that you'll pay 9.5% of your income if you don't have in insurance premiums. So 300% and up will pay 9.5% of their income in insurance premiums. Some of the other provisions is Medicaid will be expanding the eligibility. Oklahoma is not participating in that expansion. This does not cause a penalty to the state, but it does keep the same amount of funding. They won't receive more funding. Insurance companies can't establish spending caps, so they can't tell you how much money they can spend on you. They can't refuse you money. Several other provisions, I just won't go into them, but in conclusion, the Affordable Care Act is so big, and there's so many provisions within it, and there's so many different things that are going on. I just can't cover it in 5 to 7 minutes, but I do encourage everyone to be educated about it so that when the dates do come up, it's going to affect you as an individual, so you will know what's going on. Thank you.